Healthy and Happy Living with Tiryaq, where we explore the keys to a vibrant, active, and fulfilling life. I am Dalia Gamil. Hopefully, you can hear my smile. Today, we're joined by an extraordinary guest, Professor Dr. Samih Tarabichi, the godfather of knee replacement in Dubai. With decades of experience, he has revolutionized joint replacement surgery, particularly in knee and hip arthroplasty, earning global recognition for his innovative contributions to the field. Dr. Tarabichi's passion for improving patient outcomes combined with his groundbreaking work on full flexion knee joint has made him one of the most respected and sought after surgeons in his field. Dr. Tarabichi has helped thousands regain their mobility and live pain free. In this episode, we'll dive into insights on maintaining joint health and embracing a lifestyle that keeps you active well into your golden years. If you're dealing with knee and hip pain, Dr. Tarabichi's expert advice will empower you to take control on your health. Let's get started and learn how to live healthy, happy, and joint pain-free with Dr. Samih Tarabichi. Welcome, Dr. Samih.
Thank you very much. Thank you for the nice introduction.
Thank you. Dr. Samih, please share with us your journey to becoming the leading joint replacement orthopedic surgeon in the Middle East region.
I was practicing in the United States. I practiced in Florida. My main interest was joint replacement. I moved to Dubai 30 years ago, and I started practicing. What struck me when I started practicing that there was nobody doing joint replacement. It just the faith in this operation was not there because we did not really build confidence so the patient can accept that option. If you compare it to, for instance, to the United States, annually there is like 1 million total knee done annually, and in Europe 1.5 million annually.
Okay.
There is similar number in the hip as well. The point is joint arthroplasty has really pretty much exploded in the Western world. The acceptance of the surgery is starting, and people now recognizing that the outcome is excellent. So there's a lot of people accepting it as an option. Actually, most study now shows that the growth in joint surgery is going to be more in the Asian market than any other part of the world because there are millions of people who need this surgery who hasn't had that option. One of the interesting things that used to be a burden for the patient, especially for locals, is the fact that they cannot kneel on the ground after surgery. So they decline the surgery because it doesn't give them their lifestyle back. I remember once, a Emirati gentleman telling me, well, I have to sit on the ground because when the sheikh comes to the majlis, he sits on the ground and I can't sit on the chair.
Aww.
So if you don't really give me a full flexion, please don't touch my knees. This was his message. Because it's the traditional thing that their majlis is while you sit on the ground. So you have to respect that. We refer to this as lifestyle. The point that I'm trying to tell you, when I was in the United States, nobody came and asked me that he wants to kneel on the ground.
Yeah.
Saying that though, and this is very interesting, after I got involved and did some communication with the biggest company in joint replacement, Zimmer, and we designed a knee that more compatible with full flexion, their sale for this implant was higher in the United States, in Europe, than in the Asian market.
Yeah.
And the reason is, even the American thought, okay, I want to sit on the ground. I want to play with my grandchildren. I want to do some gardening. I want to stay active. Actually, there was studies done by a doctor from Texas called Noble. What he kind of did is he surveyed patients, even American, who had total knee replacement, most of them were frustrated that they cannot kneel down.
Yeah.
The patient nowadays is different than the patient when we started total knee replacement. That patient earlier on was a patient who just wanted to go to the kitchen and do his daily living. Now the patients are more active. So
Yeah.
he's going to ask you about golf, he's going to ask you about activity. So the people are really more demanding. So, and that's why this particular full flex implant had a higher sale in the United States, because even the American wants to stay active.
Yeah.
They wanna live more fruitful life.
Thank you for helping reset the mindset, because now, according to all studies, the youth age is starting at 60. So, for patients who are at 60 who can live up to 90, giving the longevity, they want to spend those 30 years active, taking care of themselves, taking care of their grandkids, doing a lot of like leisure work, as you just mentioned.
Absolutely, and that's what I mean. The patients are different. They're healthier.
Yeah.
They want to be active. You know, the other part of it is the fact that a lot of elderly patients now, they live alone. They depend on
Yeah.
themselves. They have to be, you know, dependent. You know, in another
Yeah.
word, it's not the issue that I wanna be pain free. No, I wanna be active.
Yeah.
I remember once I was in Florida, I got a patient who was a farmer, tall guy, like 6 feet plus, muscular guy, and he's a farmer. And I did an X-ray. I told him that, hey, you had a lot of arthritis, you need surgery, and he said, but I can tolerate pain. So, in another word, I'm gonna just live with it. After a few months, he came to my office. He said, do the surgery. And I said, why? Is it you can't tolerate the pain? He said, no, I am a farmer. And a lot of time I am alone in the farm.
Yeah.
And a few times I tripped and I fell down.
Oh.
And if I break something, I'll probably, nobody will save me in a far distance. So I cannot afford that. And that's another part of it, is really
Yeah.
because people, they were studying in England showing that people who did not have joint replacement had higher percentage of hip fracture. Why? Because this knee feels stable and they tumble and they fall down. So it's not only to get rid of the pain and to stay active, it's also a safe issue because our lifestyle now is different. We depend on ourselves. Probably our kids are thousands of miles away from us.
Yeah.
So we have to be self-sufficient.
That's very true. With all the advancements, also, I think there are a lot of advancements now in terms of knee replacement, hip replacement. There is robotic assisted surgery, and there is role of AI. So we have too many options to give the patient a self-sufficient life.
Sometimes I compare the level surgery for joint replacement when I left my training and compare it to what we have today. There have been multiple advancements. You know, after I finished the LPS Flex, we addressed the issue of the Asian patient. Remember, when you do a joint replacement, a total knee, you are practically resurfacing the bone. You're not taking the bone off. So you're just putting a layer as if you're giving it a new shirt because the cartilages are worn out. So the advancement for the Asian Middle Eastern patient is we were able to address the specificity of the Asian Middle Eastern patient. Their bone dimension are different than that of the European. And we did multiple study, you know, showing the anatomy is different. And we were able to better fit the implant. So the company was able to modify basically on the anatomy of the Asian. When the total joint started, it was all European sizes. And it doesn't take a genius to figure out that European build-up is different than that of the Asian. We tend to have a narrower bone We tend to have angles that are different. So if you log on the internet and just write an Asian knee, for instance, you'll find multiple study, including study that I did, that shows that the Asian is different. So this has been, I think, a great advancement, because when I started doing surgery here, I immediately noticed that the bone shape and size are different, and accordingly we change. So this has been a great step forward.
Of course.
Now the robot is an advancement, but what recently had been, I think, a breakthrough for us is pain management. When you do surgery after joint replacement, there is a period where the patient are gonna feel pain and discomfort. It used to be, especially in knee, a very concerning thing for the patient, and it's concerning for us because first, we don't want him to hurt,
Yeah.
and second, we want to control the pain so the patient can progress with physiotherapy. Because if he has pain, he's not going to progress with physiotherapy. So we have a special interest in controlling what we call post-surgical. One of the things that we did recently, and we published a paper in American Journal, and I can give you the reference, is how to decrease the pain significantly after total knee replacement. What we did in this study is we freezed certain pain nerve around the knee. So what we do in surgery, after we finish the surgery, we freeze those nerves. You know, there is an instrument like a pen.
Yeah.
You just lay it down on the nerve and it freezes the nerve. It freezes it for 3 to 4 months.
Okay.
And what we found in this study, then when we do that, actually the patient has much less pain and much less need to take narcotics after surgery.
Yeah.
And to really go ahead with his physiotherapy. So this is the most latest thing that we have done, is the pain management, which was a very, very common complaint for the patient, saying, but they told me that the surgery hurt. Yes, it hurts, but now we have ways into decreasing it and in controlling. This we call it a cryotherapy. Cryotherapy just freezes the nerve for 3 months, 3 to 4 months. After that, the deep pain sensation comes back. But by then, the patient would have recovered.
Yeah.
And we controlled his pain in the most critical area, and that is immediately after surgery. So what we found in this study, that the need for painkiller has much decreased in those patients. So we were excited about this development, and we recently are applying it in our center, and we were the first in the world, no doubt about it, to use such a technology. How did we develop it? Well, we learned from our thoracic surgeon colleague, because in thoracic surgery, one of the most painful things is when they open the chest wall.
Yeah.
So what they do normally after they finish the surgery, same thing. They freeze the nerve between the ribs, so the patient have a controlled pain. So it seems to be working pretty good. Now, the other aspect, the robot is here, yes, and we are doing it, but the other expecting, I think, things that's gonna accelerate is the AI. But the AI is not related to the patient care per se. It's really a tool to help the surgeon choose the most proper design and implant for the specific patient.
Yeah.
I think as the AI evolve, the surgeon will come and put certain data, put the X-ray, and do some kinematic study, and the AI will help the surgeon to decide which kind of implant that he's going to use, how much constraint level he needs. When we say constraint level, you know, like for the knee, it means constraint, meaning stiffness.
Yeah.
We knew long time ago that the female tissue are softer and more elastic than the male. And we adjust it normally based on experience and manually.
Yeah.
But I think in the future we'll be able to set numbers and data so the surgeon can say, okay, I'm gonna tighten the ligament to X amount and do this, based on not only the gender, but based on this patient, because there are some male that are more flexible than other females. So I think the improvement in the AI that it's going to give us is really planning for the surgery and the choosing what is best option for that specific patient. Today, more and more, we're tending to stress on the fact that the treatment for any patient should be individualized. We have so many options, not only robotic, but even the implant design, how it's applied, the constraint of the implant. And sometimes among those options, it's not easy for surgeon to take the exact decision regarding what he is going to use. The AI is going to be of great help into individualizing the care. The other thing that also that we're looking for in the assessment of post-operative patient is putting sensor on the skin of the knee. Actually, there are new ways that we put sensor inside of the joint.
Wow.
So in a way that I will be, the nurse will be sitting in the office and she will analyze the patient gait, and she will probably, exactly find out how much step he took a day and whether he has limp and whether there should be some kind of modification of physiotherapy accordingly. So that's also a great breakthrough. They are linking the sensors that we put on the knee along with your iPhone. So in another word, if there is something that is, worrisome, I'll be able to see, as a doctor, that there is an issue, in his physiotherapy. Then I can more properly delegate with the physiotherapist and do the proper post-operative care, even when the patient is at home.
Excellent.
So
Actually, to me, this sounds like a dream.
It is. So in a way, again, the name of the game now is individualizing in the patient. There's no two. I always tell my patient there is no two patients who are alike.
Yeah, that's right.
Yeah, don't tell me that my neighbor had this. Let me feel free what is deciding what is best for you as a person based on your body mass, based on your soft tissue laxity. Not only is that, based on your work environment and your build up, your structure, And so the AI is going to be a great help for us. Okay.
That's awesome. Dr. Samih, given your experience in the Middle East region, and it seems like also in international statistics, how do cultural practice such as diet or physical activity patterns affect joint health?
Definitely lifestyle affect joint health. I think one of the major issues that we're facing nowadays is that the fact that people are needing more and more joint replacement than before. One of the major issue is weight.
Yeah.
I think if you review statistic in Europe, and in Europe is not as bad as North America. In North America, weight is an issue. In our region is an issue. You have to remember that arthritis are tear and wear phenomena. It's not a disease. I always tell the patient, it's not a disease. It's not that I have something wrong. No, but you just have worn out your tissue. If you want to give an example to it, exactly what happened in tooth cavity. You use the bone, so you have a cavity. Same thing with arthritis. So my point is, one of the main reasons for the increase in arthritic changes is, first of all, the weight. There's no doubt about it. That's universally. So we should be more, monitoring for this because of new modern lifestyle. We sit weak. And the second is weak muscle. When you have weak muscle, chances you're gonna develop arthritis much more than if you have, good muscles. Versus what people think, oh, I don't want to wear out my joint to do exercises. Moderate exercises actually help in the general health and help in prolonging the lifespan of joints.
Thank you. Talking about cultures in the Middle East, definitely we're interested to know more about your groundbreaking work on the Islamic knee.
Well, it's not something that we made. It's rather than trying to preserve the mobility that the patient has.
Yeah.
What we did, all the studies, the mechanical studies in the lab that address the knee bending, all the studies were limited to 120 degrees. In order for you to sit on the ground, it's 145 degrees. So it's much more.
Yeah.
They did not even study the mechanical stress on this high degree. Nobody asked me to kneel down on the ground in the States. It's a lifestyle. It's what you call activity of daily living. It varies from person to person. My point is we put a design, and the design was successful, and it got sold in the United States, and it was the best-selling joint for the company, even in the United States and Europe. So we set a design that is more friendly for deep flexion. It's not going to make the deep flexion, but it will preserve it if the patient has it.
Yeah.
One of the interesting things that I did a couple of American patients, and the lady went back to the, they went back to the United States, and she used to brag, with her friend that the fact that she can bend her knee, she just sit in, while they're, chatting, she should show him that she could do what they cannot do in the United States. So it is not only to preserve your lifestyle.
Yeah.
I always tell patients that, don't think about it. Some people tell me, why should I never use it? No, you need it. Sometime if I have a patient who had a full range of motion, if he, God forbid, fell down, he'll be able to get up by himself.
Yes.
Why? Because he can bend his knee and get up. If you have limited range of motion on the knee, you need someone to help you and to get up. Why? Because you cannot bend your feet below your pelvic to get up. So I think this has been not only cultural, it has been lifestyle, it has been also preserving for the patient confidence in himself. Like,
exactly.
God forbid if I fell down, I need someone to get me out of the. No, you don't. If you have preserved your natural movement, you will get like a normal person. You will get out like a normal person.
Yeah, and even if we're talking about the healthy lifestyle for a candidate or a patient, like as you said in the beginning of the discussion, people now, given the longevity, they need to be self-sufficient, very independent. And I've seen even some grannies at the age of 70s who are taking care of their great-grandkids. So, people need it.
Yes,
people need it.
It's a necessity. It's not a luxury.
Yeah, it's a necessity, not a luxury.
Yeah.
Dr. Samih, do you think the mental and emotional journey of the patient undergoing joint surgery is affecting the outcome?
Definitely, it's a factor, and you have to respect it, and hence, the pain control issue that I'm mentioning to you.
Yeah.
Again, we individualize people. We don't want them to slip into what we call a post-surgical depression, to where they feel like, oh, nowadays we take care of the nutritional status. We give even some medication to make them more, alert and to sleep better also. So you have to take that, definitely that aspect into into factor. There are even survey now preoperatively with a patient that we do sometime in a certain patient, not all the patient. Why? Because we know we don't. A lot of the people, they come to us what was I call, and they have surrendered, like they have given up. So we give specific attention, some motivation. You have to build it even before surgery, so the patient does not continue with the same attitude. In another word, sometimes even group sessions that help. We bring a patient who had total joint, and then he talks to other patients saying, "Hey, listen, you're hurting now, but do one this too, it's gonna go." And something little like this will make things much better for the patient, because our psychological condition definitely will reflect on your physical being.
Agree. Please talk to us about the unique story of building trust with your patients.
Trust is multifactorial. It starts from the patient checking your track on the internet. It comes also from your staff. I always really value a lot what I call friendship. We had a lot of people who comes to us from other countries, and when they come back to Dubai, they make sure that they visit us. And it's not only me. The physiotherapy has established a relation with her. The office staff, and they always feel like they're welcome, and we feel happy about seeing them.
Definitely.
Why? Because we feel like a family. We have things together, and we communicate on the phone. A lot was based on the patient wish, naturally, but there is a lot of people who comes to us quite often, and they have established a trust. But that trust did not come out of the blue. It comes us again from the knowing that they are using in the right place, knowing that they are in a special place, and the environment is different. In another word, when the patient step in, a patient once told me that the minute you step in the clinic, you feel that all the people that working with you, they know what they're doing. So it's a team effort. I keep stressing that, to the hospitals, that it has to be team effort. The same thing that the physiotherapists have to come with to learn what is the latest technology, and we have to discuss it. We had a unique experience that we did when we started, is we did a task force meeting for the entire staff, physiotherapists, intraoperative nurse, even administration, even finance. And we sit like once a month and we discuss issue, trying to smooth what I call the flow of the patient. We have been doing it now for over 30 years. And what surprises me, every time I think that we'll come to the meeting, we have nothing to discuss. Surprise, surprise. Somebody raise up a certain issue, being a physiotherapist or a nurse, that, hey guys, you're taping the, for instance, drain this way, it's not helping the nurse. But the point that I'm trying to tell you, it's education for the entire program, so they act as one team.
One story, I agree. Dr. Samih, what is the current and future possibilities of regenerative medicine in joint repair and regeneration?
We're still, unfortunately, far away from regenerating cartilages. We use it in a certain patient who are young. We have the stem cells, we have PRP injections, But it works in early changes, and it works in people who are young, because the capability of regenerating is better. Are we going to reach something in the near future? I don't think it's going to be, that quick. It's an ongoing thing. But so far, it is limited for early arthritis, and it's limited for young patients. And it hasn't replaced, unfortunately, the surgical option. So you have to decide in an individual patient again. But in reality, it is expected that we will have a better understanding of the growth factor of the cartilage of the knee. And hopefully, we will have what we call as a medication that modify the degenerative process. But are we there yet? Definitely not.
We are waiting for it.
Okay.
How important is it for patients to be educated about their treatment options before making the decision?
It's very important. I always, every time, sometimes I get a very sophisticated patient and they ask many questions, and you can see in the family, some of the family get kind of looking at their mom or their daddy, hey, you ask too much. And I tell them that please let them ask.
Yeah.
And the point that I make is, if you bring me a patient who understands what is he going through, I can deal with this patient much better than if you bring me a patient who is totally confused, who he doesn't communicate with you, and he cannot relay the message that you want. Unfortunately, I have to do patients sometimes who even don't communicate because they're not walking on their own. Those are the patients that we have to do extra care for them. But surprisingly, all those who ask a question, they do better, even statistically, not my statistic only. But there are a lot of studies showing those who ask and understand the pathway come out benefiting much better than, say, a patient who is not communicating. Then if the patient asks a question and understand, he will help me sort of in my work. I'll tell him I want to do this because 1, 2, 3. So when I understand that, he will do it.
Yeah.
Versus I don't know why they're doing this,
Yeah, and it's one of the patient's rights, and I think it's always very good for the patient to be on the same agenda with what the doctor wants to offer him, because if he's convinced, he's gonna be very easygoing with the process.
Yeah.
Dr. Samih, what's your philosophy for maintaining healthy and happy life?
Sometime checking, again, you have to live a health lifestyle. Unfortunately, the modern life that we have is not the healthiest ever. So I usually like patients to take good care of themselves, maintain their weight, do the exercises, and try to inquire about things before it is progressed to a bad situation. To give you an example, I'd rather see, for instance, young patient who had deformity in the leg much earlier, because sometimes I can prevent the need for total knee replacement.
Yeah.
In other words, if you have an issue, ask it, try to find a solution, or at least to understand, is there other alternative before I get there? Don't take it for granted that we're all gonna have arthritis. No. Just if you have an issue, address it early on. Don't wait for your knee to be painful to the degree that you can't walk on it. No, do it earlier, because a lot of time we have options that we can offer to the patient before proceeding to a major surgery.
That sounds excellent. What things patients can think about as early signs to take an action?
Wrist pain is an issue. Wrist pain meaning I am not doing anything, I have a severe pain. Then there is, something else going on. We need to really address it. I'm talking about warning sign.
Yeah.
Pain that is progressively getting worse. That is also kind of a warning sign. Feeling of instability or buckling in the joint also is a warning sign. But the transient pain that we have sometime because I did walk more than that's usually not not alarming. It happens to anybody. If I do exercise excessively, I'm going to have some discomfort and pain. So, but the continuity of the pain and the progression of the disease and the pain at rest are really something you need me to check out, along with I feel the knee is unstable or it's buckling under me or it's locking. Those are signs that there is some mechanical issue. You should recheck it.
Sure. Dr. Samih, as someone dedicated to a high-demand profession, how do you maintain work-life balance?
I don't.
Actually, it's too much like in the thought of everyone who's thinking about someone who's extremely professional, how they maintain work-life balance. And this brings us to the end of Healthy and Happy Life with Tiryaq today. A special thank you to Professor Dr. Samih Tarabichi, the Godfather of Knee Replacement, for sharing his unparalleled knowledge and insights with us. From groundbreaking knee surgeries to practical advice on joint health, Dr. Tarabichi is truly shaping the future of orthopedic care. Remember, whether you're managing an existing condition or looking to stay active, your joint health is key to living happy, pain-free life. If you enjoyed today's episode, please take a moment to subscribe, rate, and share this podcast with anyone who could benefit from Dr. Tarabichi's wisdom. And as always, keep prioritizing your health because living healthy and happy starts with you. Until next time, keep moving, stay strong, and remember, a healthy body leads to a happy life, and take joy wherever you go. Thank you, Dr. Tarabichi.
Thank you very much. Thank you. I enjoyed it.
Same here. Thank you.